Hello, Gypsies. Today we'll be having Jill, Rose, and Wendy from Travel Nurse Across America come on and speak more about COVID-19 and travel nursing. But before we begin, we would like to take a moment to recognize what is currently happening in the nation. The Gypsy Nurse team knows there is a lot of hurt in our community, physically and mentally, as well as anger, sadness, confusion, and so much more. All of us at the Gypsy Nurse want you to know that whatever you're feeling, we see you and we hear you. Our thoughts are with you every day, and we're here to support you. We want to thank everyone in the travel nursing community and nursing community who is standing up for what is right. We condemn racism in every form, and it has no place in our nation. We thank the nurses who continue to be on the front lines taking care of others during these troubling times. We pray for healing and for a brighter future for all of us. So thank you again. So I am now going to bring up Jill, Rose, and Wendy from Travel Nurse Across America, and they're going to be able to answer your COVID-19 questions and travel nursing questions. So hello, ladies.
Here we are. Hi.
Thank you, Rachel. You're welcome. I'm going to jump down and everyone can ask you guys questions.
Awesome.
Thank you.
Wendy, it's great to have you join, be part of our trio today.
Thanks. Looking forward to it.
Wendy, y'all know us, so, but we should probably do a little something, Jill. I know you hate this part, but it is what it is. So I'm Rose Fulton. I'm the Senior Vice President of Recruitment at Travel Nurse Across America, and very excited for these forums and looking forward to connect with nurses out there in the Gypsy community and other travelers to share what we know and to help everyone navigate these unprecedented times. So hand it over to you, Miss Jill.
Thanks, Rose. Yep, my name is Jill Eliassen. I'm the VP of Clinical Services here at Travel Nurse Across America. Also a registered nurse of 22 years, so it's great to see everyone again. And I'll pass it to you, Wendy.
Hi, I'm Wendy Bledsoe. I also work for Travel Nurse Across America, one of the clinical liaisons. Started in October, switched over from my role as a travel nurse, which I did for 2 years before that. And I've got like 30 years of experience as a nurse.
Unbelievable.
Long time.
They got you guys young. Man, they get you young. Boy, the grip's good in
Rose.
They do. Wendy, it's really fun to have you on board just because you have such a great perspective. When Jill was talking about you joining, I was like, cheering because you've got this phenomenal perspective of being a travel nurse within the last couple of years, within a year, and then joining our team on the clinical side to really coach and advocate and mentor nurses across all specialties. So we're so grateful to have you. You've been a great addition to our team. And I know Kathleen Delisant, your recruiter, loved you, and she's been talking about you from the beginning. So
yeah,
so fun.
Kathleen, my biggest fan.
Yeah,
no, it's been a
big fan.
It's been a great transition. It's been fun working on this side and working with the travel nurses and being able to be a resource to them. So it's been great. Big learning curve, but it's a lot different.
Only imagine. What were your favorite travel assignments, Wendy? What was travel like for you?
I loved Reno. That was a good one. I loved the area, Reno. I was surprised. I didn't know that I would like that area so much. It was a very cool area to live in. And then I loved Savannah, Memorial Hospital in Savannah. That was a really good. Oh, and I loved Yale too. I mean, I found something really good in all my side. Yale was awesome. It was an incredible hospital, and it was very. It was nice working in that environment, that educational environment, and the residents were amazing. They were just so smart, and it was so collaborative there.
Yeah, the game is high. It's a high level.
It's
there.
Yeah, but they really respect their nurses, and they really work well with the nurses. I remember going on my tour the first day, and they were asking the nurses, "Okay, what do you think? You went and talked to the family and the patient, and what's your thoughts on this?" And they really worked together and respected you. So that was really cool. So,
right.
They've all been great.
This is the incredible thing about travel that we share, is that some of the best assignments that you have and the growth that you have are in places you would have never in a million years thought you were going to go to when you said, "I want to be a traveler," right?
Yeah. And the things you learn, like, you know, you can find something good out of every assignment. Maybe you don't like the assignment, but you like the area, you know, more than the assignment. You know, you can, if you find, you can usually find something really great about that whole assignment. And you learn things, even at your most difficult assignments, you learn something, you know. I mean, the ones that you want to just, you know, go home and cry after, but boy, when you're finished it, you're a better nurse. And, you know, you learn some really good skills. You become very adaptable.
You know,
So,
that's words of wisdom, folks. And I know there's lots of gypsies out there who are thinking the same, who have the same experience, or who are thinking about travel, not really sure, kind of wanting to dip their toe in the water. You know, definitely come forward and ask questions, because we've got somebody great on here who can really speak in the first person. So Jill, we got some questions beforehand that had to do for the three of us. So the three of us are going to take on these questions and have a free conversation around COVID and how it's impacting the industry. So one of the first questions we got was, what specialties are the ones that we're seeing jobs for? Jill, so you want to kick us off on the specialties?
Yeah, ICU, ICU, ICU. ICU nurses, always in high demand. Now, obviously, there's going to be some more with many of our ORs starting to open back up. So don't forget all your peri-ops, your pre-op nurses, your OR nurses, your PACU nurses. Those are really starting to bounce back into the industry as things are slowly coming into scope. And also don't forget the outpatient type, the GI lab nurses, the endo nurses, they're all being pulled back in to do a lot of those cases. But I covered it with ICU most definitely. And, you know, going through and seeing some of our orders increase this week has been really exciting. We're starting to see more PCU. We're starting to see more telemetry. So I think that's the gist of where we're looking at with specialties. Wendy is a current ER nurse still. So Wendy, if you don't mind telling us about how your ER flow has been through this COVID, and speak to some of the ER nurses about the changes you saw in staffing, just that you handled firsthand.
yeah, well, probably in March, they didn't need me at all. They didn't need me. I mean, I went in a couple shifts, and normally there was 100 patients and there would be 24. You know, it was so slow, and people are just afraid to come to the hospital. But now things are picking up. We're seeing more of the regular stuff, the stuff that we used to see before, you know, the maybe not as acute patients. And we're also seeing, but the patients that are coming in too are sicker because they've been waiting. And I'm seeing this and hearing so much about this, like, you know, people that delayed their treatments, or, you know, people sitting at home with chest pain for 3 days, and then they come in and they're, you know, in a full-blown MI, and just that kind of stuff we're seeing more. And the ER is definitely picking up. It's much busier now. I mean, it's not crazy busy like it used to be where people were in the hallways all the time, but the beds are more full now, but just not, you know, it's not at max potential like it was before, but definitely picking up, and with sicker people for sure.
So hang on, our nurses, it's coming.
It's coming. It's coming. Yeah. And
we also, go ahead, Wendy, what else?
No, just about, like, you know, people not doing, there were people that weren't getting their chemo done because they were afraid to go in, delaying those treatments, all those people that didn't get their mammograms and all that stuff. And they're finding testing that's positive, you know, their people are coming in later. So they're seeing a lot more of that kind of stuff.
Right. You know? All these things didn't go away. Right. In 3 months, we didn't all of a sudden rid ourselves of disease and you know, and what's happening in terms of, you know, in each individual and dealing with their own personal health issues. Right. That didn't go away. It's just sort of pent up. Right. And like Jill said, be ready, because when those gates open, it is going to be a big deal. So that's really helpful to know, Wendy. We also got a question around what parts of the country where we're seeing jobs. So there are some states that I did some homework on, and we all are looking at job orders every single minute of every single day. And Massachusetts has just been, you know, we were talking about that before the call. Massachusetts has just been durable. So Massachusetts, New England, Maine, actually Connecticut have been real consistent in terms of needs. And in fact, we're booked nurses, some of our best nurses we've booked at Yale for on-COVID units, and they have been working on those units, and we really salute them and admire them for the work that they've been doing. Not easy conditions, and they've been incredible and sharing with us a lot of their experience and helping us prepare other nurses for what it's like. We've also seen terrific volume in Washington. So Washington is a really important state for us, and we were able to really book nurses in float pools, which is a different type of assignment. But facilities are getting creative in terms of, hey, we need OR, but we don't know which one of our facilities is going to need them all. So can we have nurses be more flexible? Can we have our travelers be more flexible in the ICUs when it comes to OR and when it comes to PCU? And we've been able to book assignments in those areas with that kind of flexibility, which has really helped us get orders in. And then we've also seen Maryland. So Maryland is looking like, and when you read the reports, look at the news, Maryland has some COVID surge, and we do have nurses. We actually have two nurses, a travel pair, a couple who we love, who were in Idaho in March, April, May, and now they just started their June assignment over in Maryland, and they're keeping us very much on our toes about what a different world it is. They're tele-nurses, tele-IC, and they're like, oh, this is no joke. This is not a drill. This is real. So we're seeing really fast moving in Maryland also. So that's been another area that we've seen jobs happen. And then California is California. And for the right nurse with the right license, California comes through. And then we're starting to see other parts of the country pick back up. But the big ones are still really quiet. Texas, quiet. We're so sad that Renown has just gotten really quiet. Florida, quiet, so we've seen a lot of quiet around in places that usually aren't. And in fact, New York has gotten quiet just because they've stabilized, and all the good work and all the intensity has really been able to help them get ahead and deal with the volume. So New York has quieted down quite a bit. We're seeing a little bit in New Jersey, but that's what things look like in terms of what parts of the country we're seeing. Anything else, Jill, that I might have left out?
No, I don't think so. I think you covered a majority of them. Absolutely.
Right. Great. And then we had questions about, why don't we just dive into just COVID testing? Let's take on that, and then I'll talk about the what if question. What if I'm exposed? What happens if I get it? So let us know what you're hearing on this, Jill and Wendy.
Well, there's just great access to COVID testing now. So I think a lot of our communities and areas across the U.S. are seeing increases in the amounts of COVID tests that can now be done, which is intriguing. At the same time, it's making a lot of positive cases in some areas because there is more testing. I think something that nurses and healthcare professionals need to consider and think about right now is you're probably going to be tested at the start of a new assignment. I think even some perm staff members will start to be tested if they've come and gone from work for a week or two. If they chose to travel somewhere, you may face a COVID test when you return. So always keep it in mind. There are several different types of tests. They even have at-home testing available at this point in time. Some of them have a very rapid turnaround of a day. So it really is good news to a travel nurse. You shouldn't have to sit and wait for a week to get your COVID testing result like you had to in the beginning. There are still some areas who do function a little slower because our LabCorps and our quests are overwhelmed with the volume. But for the most part, your turnaround and your results are very fast. And I think that's fantastic news.
Great. Improvement.
Mm-hmm.
Yeah, from the beginning when we were all uncharted territory, right? And it was like, okay, you're going to have to quarantine for 2 weeks, and there you go. So yeah, really different and very difficult in the beginning. So it is progress. But right, every solution creates another level of complexity and a little bit of a little bit more responsibility. So we're keeping very aware of that, asking lots of questions for y'all, and doing everything we can so you know that on the front end, so that way you are aware of what's expected before you get there, while you're credentialing. So we're keeping on track of that. Anything else to add on COVID testing for travelers?
I think that's it. I think it's just, don't forget, you've got to abide by the hospital policy and what the hospital is requiring you to do. You can always contact your agency if you ever question a process or question what you're being asked to do. But for the most part, you've got to comply with what that hospital policy is and what they have in place.
Okay, great. Thanks. We got another question that came through around what if I'm exposed? What if I get COVID from a patient? And this has come up on every call, obviously, because people really want to know. And for some people, this is kind of, am I going to travel or not? Right. This is the question. This is the thing of why would I? Why should I now if I don't? So we have really advised our nurses is that it's so important, right, that they follow their hospital policy. So although a traveler works for the agency, we're the ones that pay you, we're the ones that cover your PLI, we're the ones that credential you, etc. Right. When you're on the unit, you follow those the policies of the unit. So that it's so important that if you are exposed, that you notify your agency, because every agency is going to have different policy and protocol around how it is that they are going to coach and counsel you and guide you through their process. And every agency is different. So if you are looking at agencies, if you're concerned about this question, make that part of your interview questions with your recruiter. So make sure that when if you're talking to an agency and you've got recruiters contacting you and you're thinking, hey, maybe I want to travel, see how they answer that question. And a recruiter at the agency should be able to tell you exactly what their policy is and exactly what the protocol is. And if you're satisfied with it, then it makes sense to move forward. Look at reviews, make sure it's a reputable agency, make sure that you know that they know and they've got credibility in their joint commission and all of that. And then once you've got that answer, then you make the decision for yourself of whether or not that risk is worth it. And we've been seeing a little bit of everything. We've seen new nurses get into travel right now because they are ready to travel and this is what they wanted to do, and they're experiencing that and dealing with the risk. And we've had some travelers sit it out because they decided that this isn't the right time for them to travel based on what their life is like. So it really depends on the individual. Any other thoughts on that, guys? Ladies, guys? I'm from New York. I say guys. I say you guys. So,
any thoughts, Wendy?
Yeah, I mean, I think that's what I've been seeing too. It's a very personal decision right now, and how it fits in with your life, and who have you got at home that you're worried about exposing or not exposing, or is it, do you just want to go out and help? Do you have that drive? So, like I said, I think it's just very personal, a decision about how it affects your life.
I was thinking about, we haven't gotten a ton of questions right now. So if people are out there lurking and thinking, oh, I wish they'd talk about this, please jump in. We do a poll before this. So Gypsy's really great and they put out topics and you guys vote on them. So we are going through our top voted on questions of what y'all wanted to hear. But I did want to talk about one of the questions that came up. What had to do with how fast jobs are opening and closing and what's moving and all of that. So, oh boy, this is the bane of our existence as a recruiter right now, is that the competition is really intense. So for instance, we've heard stories of, an ER job posts and within minutes, they've got 50 files, 100 files. So there is absolutely a moment right now where it is a race. So whereas you could have gotten a job, whereas pre-COVID, you would get a job in, maybe a week, recruiter submits you got files out, whatever, in a week, you're like, okay, I've got an offer. That's not the case now. Now, depending on the specialty, depending on your experience, depending on where it is that you're looking to go and what you're willing to do, then that job search could take 2 weeks. It could take 3 weeks. So having your timeline flexible, really looking at your start date in a different way is important. Because when you started your job search, you may have said, I can start at this time. But if your job search takes 3 weeks, then your start date's going to change. So be aware of that. Keep communicating with your recruiter. And so important, 2 things, which I really want this clinical experts here to weigh in on, which is making sure you've got the best profile possible and what to highlight. I want to talk about that. And then also just talking about readiness and just how important it is as a traveler that when an interview comes in, what you should be asking and how you can move along the process, right? What's in your control, what's out of your control. So Jill, Wendy, you want to talk about what are the things that nurses should be highlighting on their resumes that make them more marketable in a time like this?
Sure. I can start, Wendy, and then you can pick up maybe where I didn't mention a few things. But I think one of the key things is just to make sure your work history is very accurate. Make sure you mention everything about every hospital you worked at. Leaving off a level 1 trauma center isn't in your best interest. It's really good to show the top-notch hospitals that you've worked at in your work history. I think the second most important thing is your skills checklist. And a lot of travelers and nurses don't think of it as a selling tool necessarily, when it certainly is. So think consistently about your skills checklist. At TNAA, we've got a fantastic clinical team, and Wendy Bledsoe is a part of it, and we'll talk one-on-one with you and walk through how you should answer those questions on the skills checklist. It feels like you shouldn't have to put that much thought into it, but we really want to focus and help our nurses have the best skills checklist. A couple of examples would be to not underrate yourself. If it's something that you were trained to do, something you know how to do, and something you have a resource for. So such as the medication section, just because you didn't give a specific medication doesn't mean you don't have a resource to look up what would happen if you did give that medication. Give yourself some credit on that skills checklist, and definitely work with your agency to make sure you've updated it. In regards to the skills checklist right now, based on how our industry is flowing, I would update your skills checklist after every single assignment. That is something the Joint Commission only wants us to do it once a year. You as a nurse don't continuously think about it because you're working and you're busy and you have a job. Right now, our industry is a little bit different. So I would update that skills checklist. As you guys heard Wendy earlier, she learned from every travel assignment she went on. There was something new. There was something she could change on that skills checklist. So always keep that piece in mind. I'm a freak about the skills checklist. So Wendy, what else do you have surrounding what nurses can do to get themselves ready?
Yeah, we've been really focusing on that right now, is making sure that they're accurate and that they're, because I know when I was a traveler, maybe I didn't put enough thought into that. I didn't really think it was that important. I didn't realize that's what the managers are looking at. And they're looking for, the areas that they want strengths in. They're going to go the skills list and say, does my nurse have that strength? And that's how they're going to decide who gets that job or not. And especially when the competition is big now, you want to make sure that you're giving yourself the most credit you can, for your specialty and your skills. And so that's something we're, really focusing on and trying to make sure everybody is aware of, and make sure they're thinking more about that and taking more time to do those. And I love the idea of doing it after every assignment too. Yes. I think that's great because you learn things every place you go, you get new skills. I mean, that's the great part of travel nursing. You become a better nurse, and you got to show that. You got to show that through your profile and everything, and make sure you look good. And then I think, like Rose addressed earlier, like the interview, learning what to ask if you do get the interview. What do you want to know? I mean, you're interviewing them too, I think, in this time too, as they're interviewing you, and you got to make sure that it's going to be what you want too, because there's different standards, and you want to make sure that you ask the right questions, and then that you promote yourself to make sure that they understand what your skills are and that you are the right person for the job, because you don't have very long. You only have a few minutes, and then you don't get to talk to that manager again. So you better, it's really good to think ahead, plan it out, write it down, get your questions in order, put them all down, what you want to ask and what you want to tell the nurse manager about yourself, and do a little research on the unit. That doesn't hurt. Make sure that you are going to somehow jump ahead of everybody else by the things that you say. I think that's really important.
Perfect. That was excellent.
It's like this, mic drop. Like everybody who's watching, that's it. You just got the masterclass. You just got the masterclass on your profile right now, and how the skills checklist is calculated into whether or not you're going to whether your file is even going to get sent.
Mm-hmm.
And then Wendy just hitting it home around just the interview and highlighting your skills and making yourself marketable and how you're going to stand out from other nurses. That was the masterclass. It's very important that people understand this, is that, this has always been the case. It's just that the competition is tougher because there's less jobs, right? But it's always been this way.
Right.
Always been this way. You got to have a great skills checklist. Your work history has to be really smart and accurate and highlight your skills. And then the interview is so big because the interview, right, is your opportunity. Like Wendy said, this isn't just about you. This isn't about you liking them, or that it's about them liking you, you liking them. It's got to be a fit because 13 weeks is 13 weeks. And making sure that you answer the phone. So guys, nurse managers could be texting you, maybe, but they could literally just be in their, I'm serious, they're in their car because that's the only place they don't get interrupted. They're in their car on their cell phone. And maybe they printed out your profile and they're sitting there in the parking lot and they're calling their because their CNO is like, you better get some travelers in here. I don't care how busy you are. And that's how these calls happen. So it's like one after another after another. If you don't pick up the phone, you're screwed. They're not calling you back.
Yeah. You missed your opportunity.
Yeah.
Rose, I had one more thought. That was a great one. I think another fantastic thing that nurses can do right now, especially if they've got a little downtime, is work on certifications. Nurse managers and directors love to see the education on your profile. I've seen a lot of social about this. Does it help me if I'm a traveler, if I have this cert or that cert? Any type of education that you can add to your profile is a benefit. So if you're thinking about getting that CCRN or the Med-Surg certification, right now might be a great time to study for it. Do it. Hammer it out while you're waiting for an assignment. That will never hurt you.
Great advice.
Good suggestion.
Great advice. Right. Don't do your time, use your time. Right. Don't do time while you're off. Use your time for you. Right. And I think that's really important. These are fabulous suggestions for everyone. And it's just this constant education. And when you're talking to agencies and talking to recruiters, they better sound like us. Otherwise, you could literally be sending a profile into, the abyss. So making sure, right, that you're working with the right people who understand the market, who can explain this process to you. Otherwise, it's really confusing. So make sure you get the clarity you need, and we're here for that. And Sarah Hamill, thank you, Sarah. Yes, I love seeing Sarah's name when we get questions and comments. She's like a nice little she's like a terrific little life preserver for us. What can I do now to be ready when specialty jobs open? And this is it. So that's a big one, is being able to make sure your profile is up to date. Jill gave great advice on the certs. So making sure that your profile is ready. And also to look at, at Travel Nurse Across America, we've got technology where you can literally sign up for job alerts. So when the jobs are happening in real time, like our recruiters do. So just be thinking about technology and how that helps. And with us, our jobs are real time. That's another really important thing about being ready, is that not every agency maintains their jobs. There's lots of agencies who maybe update their jobs on their website, once a week, once a day. We're updating our jobs 3, 4, 5 times a day. So being ready is knowing what jobs are out there and making sure that you're working with an agency that has real-time jobs. And it's funny, we look at jobs on other agencies, and they look at ours. Everybody looks at what they're posting. And there's one agency, they post the same 2,500 jobs every single week for the last 5 years. So really, that's kind of the joke, but those are some things that you can do to be for your specialty. And then, thanks, Steve. Great to see you. What types of RN specialties do you think will be in highest demand later this summer into early fall? What do you guys think, specialty-wise? What's going to come back first?
I think ER is going to pick up. I think the ER is going to pick up, is my guess. And OR.
Okay.
Yep. And I would just throw in there labor and delivery. You've had a lot of people quarantined. Labor and delivery is going to pick right up.
Exactly.
Late fall.
Yep, indeed. Right. So that's exactly what we're hearing, that late summer, early fall, Steve. And in fact, we have, the travel nurse community, the MSPs, the VMSs, the large players, the agencies that really work with lots of jobs and lots of the bigger clients. That is exactly what we're hearing. They truly believe that things are going to stay lean for June. for July. And then in August, we're just going to see the seasonality that we always see because the flu season is still the flu season, respiratory season is still the respiratory season, census is census, and those things are not going to change. And that we are going to see just a much stronger jobs market come August, September, October, November, December. That's what we're hearing. That's what we're hoping for. And that's what we need to be preparing for now. Sarah Hamill, look for COVID discount codes for certs. So yes, there are a lot of discount codes that are coming out to really give to nurses right now. I know nurses deserve a hell of a lot more than some discount codes, but but nurses have been seen in a way that has made this country so proud. And nurses have been seen in their heroism and their humanity in a way that is just over the top. So during, I think the heat of March and April, lots of companies, whether it be retail companies, whether it be education companies, have been putting forward discount codes for nurses. So there are certification discount codes out there for y'all. So that's a good resource for you guys to be looking into. Lucas, thanks for your question. Thanks for playing. I currently work Peds ER, and we have seen almost return to normal, as well as other hospitals in town.
What town? Where you at?
Lucas, tell us. So Peds ER, oh my gosh, it is heartbreaking for us as recruiters, because we really bond with our nurses and we have these connections that, we've got nurses who've been traveling us for 5, 10, 15 years. And to not have jobs for them is really heartbreaking for us because we're in the jobs business. And it's been especially hard for our Peds nurses, our Ped ER, our NICU nurses, that our PICU nurses. That has been hard for us and for you. Because we wish that we could book y'all because y'all tend to be some of the most loyal nurses we have, and we really enjoy working with you. So it has been a tough thing. I'm really glad to hear. Little Rock, Arkansas, middle of nowhere. Yeah, tell me about it. I've been to Little Rock, Arkansas, in the middle of nowhere. That's the TNAA. Lucas, what the heck? TNAA headquarters is in Little Rock, Arkansas. Dude, Pinnacle Mount, like Pinnacle Park, the whole mount, like we get it. Yeah. The river's beautiful. We totally get it. Have you been to the piano bars downtown? I mean, that's some fun. So I know it's in the middle of nowhere, but it is really friendly and nice. And Samantha's on Main. They make some good food, some good drinks. Capitol Hotel. We know our Little Rock. So that's really good to hear that you're having that things are coming back where you are, especially for your ER nurses. You're not good bored. You don't do very well being idle, do you, Wendy?
No, not at all.
Sitting around and not being busy. Nope. Well, that's really good to hear. We're starting to see that with our nurses too. What's been great is to see what a difference a traveler can make. And we've been astounded at the fact that our nurses, even in specialties that aren't being called for right now, how they're getting extended at their current hospitals, how their previous hospitals are wanting them back. So there is something that around the fact of, if you're really good at where you are, and, Jill and Wendy were really talking about your profile, and when you get in, that is a great place to be. So I wouldn't be doing my job as a recruiter if I didn't tell you, if you already know this, but, I got to do my job. If you've got a job right now, hold on to it with both hands, be grateful for it, be thankful. If it's a travel assignment that you're on and they're looking to extend you, extend as much as you possibly can, because the waters out there are not as calm as they used to be. But let's talk about terms and cancels, because that came up on our call too, on our survey, which was what's going on with terms and cancels, because we are, as a recruitment leader, when the jobs come back, right, we're like, okay, the nurses will come back, but there's also going to be some fear, right? I mean, nurses are going to be like, I got canceled 5 times. So what would you say to that, Jill? Get us started on that topic.
Well, to start with, we're almost back to baseline, which feels really nice for us at our agency. We had some really high weeks where our hospitals just were having to give notice for several travel nurses, and y'all felt it out there. We all felt it. The good news is is that that number is really low for the month of June. And right now we don't have any hospitals giving us notification to let our nurses go for the month of July. So that is really good news, because we get some 30-day notices, some 45-day notices, and then sometimes you don't get a notice. And many of you nurses have experienced that, and that's the toughest to endure, because it's thrown a wrench in your style and you have got to figure out plan B really fast. So I think it's important to always have plan B planned right now, and just understand what your next route will be if the hospital that you're heading to does happen to low census you or no longer needs you. I don't hold the magical crystal ball, but I feel really good about things slowly ticking back up into the direction that we all want to see. I think the best thing you can do as a travel nurse is, it goes back to that interview that Wendy had brought up, make sure you talk to the manager and talk about census and what their protocols are if they were to fall. And I think it's also really smart, and I've said this in past Gypsy Lives, to understand the community that you're going to. How are they functioning? Do they have a fast, rapid rise in COVID? Or are they low in COVID and everything's opened up and their ORs are functioning again? Understand all of those pieces so that you feel really confident and locked in to an assignment that you're heading to. Wendy, any thoughts? Anything else to add there?
I guess just along the lines of, your file, making it look good. Also, just think ahead of all the things that you have to accomplish. You get them done fast, and like the testing, be prepared on the testing. Like something, I know like it freaks out a lot of nurses if you have to do testing before or after or while you get there. But I think if you're prepared, it takes that stress away when there's a lot of other things going on. And like I used to make myself a little book, and of like every time I had some testing, all the research I did to prepare for it, I made myself a little book so that every assignment, it was a little bit easier as we went along. So just doing little things like that to make it, if you need to do a fast switch, you're ready and available, and you have the resources to get that done fast.
Awesome.
Great point.
Wendy, have you ever been canceled from an assignment, or an assignment ended early?
No. Mm-mm. I was lucky.
Yeah. Well, yeah. Frankly, pre-COVID,
didn't have much.
Not in our agency. I mean, this was not a big deal. I mean, it was like, you had some stuff that was professionalism, really. I mean, the majority of our terms and canceled happened because, something went wrong with the nurse. It wasn't the facility, like, low. I mean, that just wasn't a big part of our world.
Less than 1% of our world pre-COVID.
Wow.
And we won't talk about what the number is right now, because we're going to it will bounce back.
Yeah. So that has been, but you can see the shock value of, you've been a traveler, for 4 or 5 years, and you've never been canceled, or everything all just went according to plan or what have you. And then all of a sudden you're like, wait a second. I keep getting booked and canceled. So right. It's real, guys, and it wasn't normal. And it came along with this crisis, and it took everybody off of their stride. But we're really working hard to educate everybody around the basics, how to make your profile look good, how to make sure that you are handling and bouncing back. We talk so much about making sure you have a plan B, like Jill said, making sure you have money put aside, this is adulting stuff, right? In that, this travel, there's a risk associated with travel because the reward is so big. So being able to deal with both. We also got a question. Exactly, Naressa. Central Arkansas is where TNAA's corporate office is located, right? We're right on North Shore Drive over in Maumelle, like right Maumelle, North Little Rock. So we know exactly where you are, Lucas. Come by, visit us. Second wave COVID, that was a question that came up. And as we turn on the news and we see protests happening, and we look at pictures of not even just protests, just people, just phase 2, phase 3, it doesn't have to be a protest. It could be just people hanging out by the river somewhere, right? What are you guys' thoughts around preparation for second wave COVID?
Yeah, as nurses and as healthcare professionals, we're all looking at the research. We're all trying to figure it out ourselves. I'm constantly seeing what this doctor said versus what this doctor said, and this epidemiologist, and all of these different sides. Nobody clearly knows, obviously, but I can say this fairly, and I think Wendy and Rose would agree. Our hospitals are preparing for it, regardless of what happens. So if it does happen, they're ready this time. I think it won't be near as chaotic and messy as the first round because we have testing and there's multiple avenues that these hospitals have taken. They have COVID policies now. They didn't have that to start with, and they were throwing things together left and right. And I have seen the nurses on social media talking about the different guidelines and protocols and policies they've had to follow and how they change in a hot minute. Those are, for the most part, in place now. And I think most of our nurses are used to it. It's hard to say. I hope there's not a second wave, but nobody knows that magical answer. I think it'd be good for us to talk about how nursing has shifted to post-COVID. Wendy, so maybe you and I can tackle that quick. It kind of goes hand in hand with this. Nurses have had to change the way they work surrounding COVID. And a big part of that is because nobody can come into the hospital with your family member who is ill or who has been in an accident. They're by themselves in the hospitals with you as the nurse right at their bedside. So nurses have had to really shift gears and understand how to inform families and understand that they're on the phone a heck of a lot more than they ever used to be. Their workflows are incredibly different. I still try to figure out how a nurse with 6 or 7 patients communicates the things that they need to communicate to loved ones and still take care of that many patients. I don't know how they do it. I was an ICU nurse for a while, and I know that not having family in the room and having to be the voice in between the patient who maybe can't speak and the family is a big job now. Nurses have always done that, but it's different. It's in a different scope right now. So that's been really hard for our nurses to adjust to. We get a lot of those care calls in the clinical department. Just, whoa, I mean, my tasking is so different. My organization is so different. Gowning up and being in that PPE all day, in and out, is time consuming. So our nurses are working 60 hours a week. They're tired and exhausted, and that could get us into a whole other topic. But Wendy, do you have anything to share just about the nursing and how things have shifted? What's shifted in the ER, for example, screenings?
Yeah, that's tough because when they come in the ER for triage, we do the quick, brief triage, and then the family is left out front, and then we take the patient back without any family member. And they're like, well, he has some dementia or Alzheimer's. You're not going to know what's going on with him if I can't tell you that. Things like that. Seems like, situations that need family emotional support, like miscarriages, stuff like that. They don't let the husbands go back, and it's sad, and it's so hard for us as nurses to just to be able to we don't have time to comfort them and sit with them and hold their hand, and I wish we did, but we don't. And to not have their husband there, and then and the nurses are not good about getting back to the family. It's hard. Like you said, we don't have time. We got phones, and we try to, sometimes some are better than calling the families and saying, giving them updates, but sometimes you just don't have time to do that. And then so the family's going crazy out and, coming back in and going to the triage and saying, what's going on with my family? And well, we can't. And then it's tricky because you got the whole HIPAA thing, and how much do you tell them? Because normally you can't tell them anything because, it's a HIPAA violation, but then now they can't go back and get the information themselves. So you got to work out all those complicated issues. So it's definitely really changed. The focus has definitely changed a little bit with that communication piece.
Oof. Just my friends, my colleagues at work, someone's father, open heart surgery. And she can't, and the family can't be there. Like, or, their parents, or something's happening. And we're all hearing about this in bits and pieces of how difficult it is when you've got a family member in a very dire situation and you can't be there. And how, we think of it as family of the patient, But here's the perspective of what is it like for the caregiver of the patient when that family isn't there. That is a really powerful insight for everybody. And I know the nurses all know this, but these are things that are important to know going in, especially as the traveler, because you're going in hitting the ground running without all the other connections and all the resources and relationships that those other nurses who've been working by this side by side for 3 years might have. So how do you coach and counsel those nurses, guys? What's the advice that you give for those nurses around, just how to balance this family piece or this emotional support piece that wasn't as intense as it is now?
Mm-hmm. I mean, I think for sure the nurses need to team up.
Okay.
It's definitely beneficial to team up, find your other travelers, find your other nurses who you can partner with. Always use your resources. Some hospitals have great resources, some don't. So it really is dependent on where you're at. I think those are two top things. And the other thing is just to stay connected and just understand what change is coming next, what's coming down the pike from management, just where you can educate yourself to be better and to communicate is fantastic. Utilizing other folks to make those calls for you when you're slammed and hammered doing really critical patient care. Any other tips of the trade you guys use in ER, Wendy?
I think, just making sure you kind of step back for a second and say, what if this was my family member? Because you get so busy with your tasks and your procedures and moving the people along, and you don't really think about the family that much. And you got to step back and say, hey, what if that was my family member? And I think we got to change our focus just a little bit and pay more attention to that and spend a little more time on that piece, because that is huge. That's huge right now when the family can't be with them and having no idea what's going on. And the person's back there for 4 hours and they haven't been communicated with. I mean, that's our job. We got to get back to our basics of nursing and caring for people and their whole person, the whole person nursing. That's what we got to, we have to kind of step back and remember those pieces that I think we get away from sometimes as we, because we get so busy with procedures and stuff like that. So
great advice.
Great advice. There's nurses who've taken time off. I been on the phone with recruiters this week talking about how are your nurses, how are our travelers who are on assignment, how are the people, what are folks doing in this hiatus, so to speak, because some people have used this as a hiatus. So this is such a great topic for us, because if you've taken 3 months off as a traveler and you are coming back to work, this is what your reality is going to be like, what we just talked about, right? What's the family, with the patient experience, right? The family experience, what's required, how nursing has changed in the middle of this, or not in the middle of it. We don't know if we're in the middle, right? Are we in the beginning? Are we in the middle? Are we in the end? Who the hell knows? But for where we are, being deliberately present, this is what it's like. So this is I think we hit something really big right now of nurses who have taken time off, and when they come back, we have to prepare them for this.
Yep.
That's a good point.
Very good, because we don't know when that piece is going to end. If they're preparing and trying to prevent round 2, odds are you probably can't be with your family for the year of 2020 at least. That's what I see and hear. So it is definitely a first-time traveler preparation, absolutely, and especially if they had a little time off, Rose. Very good point.
This is brilliant. I could solve the problems, right?
Well, I think too that even the family, those basic things when the patients are on the floor, one of my friends is a physical therapist, and she said that the nurses don't have time to clip their nails. Well, the family's not in there. A lot of times the families will do simple little things like that that'll help out. That self-care kind of stuff, and the nurses haven't had time. So my friend, she's like, well, I figured I better do something. As a physical therapist, because she had to pitch in, and do that kind of role. But, I think, you got to use your team. You got to work more as a team and say, hey, this is our patient and we got to make sure all their needs are met. How are we going to do that? And maybe that'll incorporate those different groups to work together a little more.
Yes.
Collaborate always.
Collaborate always. I hear that. I mean, Jill, y'all talk about that so much, of using your resources, identifying the resources, right? Collaborating, teamwork, communication. We got a question around what resources does TNAA have for coping and support for their nurses? And This is, I mean, y'all out there in the Gypsy community, you're kind of seeing what we do every day, which is collaborate with each other. This is what we're hearing out there, out there in the facilities and creating responses. So Jill, how do you want to talk about that one?
Well, our agency has fantastic resources through our benefits and EAP, but I think some of the basic things that just the general nurse population needs to remember is to stay connected through all of these barriers. It is so important not to manifest those tough feelings that you're having and keep them inside. It's not normal for nurses to experience more than one patient dying on their shift. And we have had nurses experience a lot of patient death and a lot of things that they just, wow, that was a once a month type of thing or an every other month type of thing, or maybe nothing was like that on your unit. And now all of a sudden it's running at higher percentages. So there are so many things and offerings that are out there. Number one, check with your agency and see what they have. The second most important thing that I want to share is something that we're going to do through our agency is kind of a connection and storytelling offering for travelers who were on the front lines. And we're going to have clinicians available and HR representatives available, and we just want to hear from you. It feels so much better. Take yourself back to being a new nurse. That was always kind of freaky and scary, right? Like it took you 45 minutes to prime an IV tubing, and you're like mortified, and you're on the floor thinking, why am I so bad at this, and why did this happen? But then when you get back with your teammates and you hear about their difficulties and it took them 5 sticks to get one good IV or whatever it may be, you're like, oh, okay, that's better. I wasn't the only one who went through this and endured the pain. We're all in this together. And when you can share that with others, it's incredibly healthy. So look for more to come on that from our agency, and then always check with your agency. And I'm just a firm believer in talking, figuring out what mechanism works for you to relieve your stress. We're all different. Some of us are stress eaters. Some of us exercise. Some of us journal. I'm a talker. But find out what your stress mechanism is and use it to a T, because you really need it right now.
Point.
Yeah, I think we've been talking too about just the real trauma and the PTSD of what it's been like for people on the front line. And it's a real thing that we're really worried about, you guys. I mean, we are, because this isn't, some of the experiences that you guys have lived through or living through are not necessarily what you expected when you signed up for this profession. So we acknowledge that, and we are very concerned about your mental health. And that's one of the reasons too why we're hoping that these orders come back, because there's a lot of nurses out there who need a freaking break. You know, in the military, right, you have to replenish the front line. You can't keep the front line on the front line every single day. So that's a really big awareness piece for us. Travel Nurse Across America, our EAP program that we have access to as internal employees, our nurses have access to. We also have a corporate chaplain. Non-denominational corporate chaplain provides confidential counseling, a trained professional that can really help our nurses through the challenges. And then, as Jill talked about, we're always thinking about, Jill's been a real champion of storytelling and how helpful it is for nurses and how it really helps with nurse retention and nurse engagement. So she's been a real champion and has taught us a lot as an organization about that. So all of those things are coming because this is like nothing we've ever seen. And we really appreciate, this has been a great direction that this conversation has gone in with just what support we have, what resources we have. And how nursing has changed, in the last 3 months, which is a cataclysmic change. I mean, for this amount of change to happen in such a short period of time is like crazy, considering how long change freaking takes in healthcare, right? When you think about how long crap takes to implement in healthcare in a normal way, and all this happens so fast. I think we should do some closing. I mean, I was kind of like, what are we going to do? But it's freaking, 12:53 right now. I'm like, all right, we've been doing 53 minutes, which is sort of our time, Jill. This is sort of like our our wind down. So I just, I'll start us off. It's just, we really appreciate this forum. So thank you, Gypsy, so much. Thank you, Rachel, and the folks at Gypsy for giving us this opportunity to connect. We learned so much on these calls, and we hope that we can provide that same learning for you. So we really appreciate what everybody's doing out there, just true heroism and incredible compassion. So for you, Wendy, you want to give your closing remarks, and we'll have Jill wrap it.
Yeah, I think we're also going to see some after effect of all this with suicide and depression, and I think you're right. That was a great way to end it, because I think that's going to be the after effect of all this. And I think our nurses it's going to be hard. I think it's going to hit them later, and they're going to need our support and patience, and I think that's an important thing to remember and consider, and keep providing them those resources to them.
Yeah, I would just finalize it with stay connected, stay connected, stay connected through all your barriers, through all of your work. And we just can't express how thankful we are for all of the nurses in the industry. You're amazing to us, and we love you very much. So hang tight, hang in there, and we'll see you soon.
Okay. Hey, Rachel, before I turn it completely over, we did get a question from Marcia, which was, I would love Gypsy Nurse to host some kind of Q&A like this around Black nurses. So just in the spirit of inclusion, which is so incredibly important at this moment.
Yeah.
I am confident if you need help putting a roundtable together, then we are here for you. So we see you, Marcia. Thank you for speaking out and helping us to help make the discussion more inclusive.
Yeah, definitely in the works. So, keep watching, and then we'll, get everything worked out. And it just all happened all at once, and we're slowly catching up with everything. And, just like COVID, not putting it all together, but, it's just so much going on at once, and, we'll get everything covered. So Thank you, ladies. And, keep watching. We'll have more and more lives. We're going to have more stuff about like yoga, and trying to get more people with mental health to speak on here too. So we're just going to keep having lives, keep trying to help everybody, cover every base. So thank you so much, ladies.
Thanks, everybody.
All right.
Take care, guys. Thanks.
Bye.
Thanks, everybody.
Bye.